Well, good afternoon and welcome to our January Ranching 101 webinar presented by AgTrust. Today, you will hear from an industry expert who will share essential strategies for maintaining herd health and navigating key challenges facing cattle operations. Before we start, please join me for a short message from AgTrust.
When your passion is agriculture and a rural way of life, you need a partner who understands. That partner is AgTrust Farm Credit, formed from two trusted farm credit associations. Our mission is to provide personalized financing tailored for full and part-time farmers, ranchers, agribusinesses, and rural homeowners. And because we live in the communities we serve, AgTrust Farm Credit is here to help you succeed.
Today, you'll gain valuable information and resources to help you support the well-being and productivity of your herd. Whether you're looking to improve herd immunity, strengthen your preventative care program, or stay ahead of emerging cattle challenges. This Ranching 101 webinar is designed to equip producers with clear, reliable information straight from a veterinarian who understands the unique demands of rural livestock management. Today, we're excited to have Dr. Tyler Davidson join us today as our guest speaker from Las Cabalas Vet Clinic in San Angelo. If you have any questions during the webinar, please submit them in the chat box below or the Q&A box. At this time, I'd like to turn it over to Dr. Davidson.
All right. Well, first and foremost, thank you for all. I've been looking forward to it since it's been asked to talk on it. Sorry for being a little bit late. For the presentation.
Hey, Tyler, sorry to interrupt. I think you are glitching out a little bit on our end. Sorry. Or it might be, I wonder if I mute myself if that'll help. Yeah, we might try that. We'll try that for a few more seconds and I'll give you the thumbs up if it gets any better.
Okay. So, University. Then there 2015, so things down now.
So I think there's still some static behind you, unfortunately. And I think the static is overpowering your presentation.
Is that a little bit better?
Yes, that is much better. Okay.
Much better.
Yes,
Okay.
much
Sorry.
better. Rocking and rolling. Okay.
Okay. Well,
Sorry about that. Well, I spoke too soon. I think you are reconnecting to the audio and video. Let's see. I think Dr. Davidson is reconnecting to our audio. Can you hear me? Dr. Davidson, are you there? Well, I can see you now.
Back.
Yes. Can you hear and see me? I can hear and see you. Well, I might have spoke too
Now I
soon.
can't hear you.
I can see you now.
Hmm. Oh, I'm sorry about this.
No, that's okay.
Okay, now I can hear you now.
You can't hear me now? Okay.
I can hear you now.
I can hear and see you now, so we can
Okay,
try it
sorry
again if that
about.
works for you. Okay.
Yes,
Can you
I'm
still
I'm
see?
sorry. I
That's okay. It
apologize.
happens. Technical difficulties. Can you still see the screen all right?
Yes, I can. Yes,
Okay.
ma'am.
Great. Floor is yours.
Okay. Well, I guess you can scroll down. They've probably been looking at this for a second now. Um, yeah, so I figured a good place to start before going over the presentation is to emphasize the importance of a VCPR, meaning the veterinarian client-patient relationship. And essentially, what this is a a legally required relationship between three things: the veterinarian, the producer, and the animals that we're overseeing. And that makes sure that the veterinarian knows essentially everything about their herd, or has a general idea of what you raise, cow, calf, is it stockers, and kind of gives us an idea. And this doesn't just fit in with livestock or cattle in particular. It also fits in with our dogs, cats, small animals as well. And it is something that is required by the FDA, and the AVMA, and that's what require or gives us the ability to write prescriptions, for Banamine, Dex, things like that. And then, you start adding on antibiotics. And then if you want to start adding some, chlorhexacycline or antibiotics to the feed, that gives us the ability to write a VFD so you can medicate your feed. And an important thing about this is, to establish this VCPR, you have to have at least one in-person evaluation of the animals, of the animal in question, the premises, at least once a year, and that's what is the minimum, expectations that they expect us to, evaluate as on a yearly basis. And it's also important to mention that a telephone or email does not fulfill the VCPR. So why planning's important? And I like to think that majority of health complications are preventable, or maybe we can reduce the complication rates, or how severe some of the things that we see are. And some examples of that, vaccinations. Are you raising stocker cattle, and you getting them from the sale barn, and are you are where they're high risk for some respiratory disease, and are they being immunized appropriately? Dystocia mitigation, are you having to pull calves year round or during your breeding season? And are you allowing your heifers to become 65% of their mature body weight before breeding them? Are you allowing them to become 85% of their mature body weight once they actually end up calving? Are you maintaining their body condition score appropriately? And then fertility and reproduction, are you testing your bulls year round? Are you fertility testing them? Simple things like that can go a long way into ensuring that your operation has success. And that's what planning allows. It allows you to, one, increase your market returns by having more calves, getting more cows pregnant, preventing disease. The less input you put into an operation and the more money that you can bring in is sort of the definition of a successful business enterprise. And then also planning will allow you to improve your labor efficiency. Are you able to concentrate your efforts more into a breeding season where you're going to work your calves in the spring, for instance, and it helps you to hire, if you need hired hands, it helps you to give them advance to be able to get those people scheduled out to help you. And overall, you're just going to have healthier cattle because of it. And so, what role does a veterinarian have, for a cattle operation? And, there's, these are some general points, but, we can preventative health, we can help you. We're not necessarily going to give the vaccines to all of your cattle, but it sure helps. We can sure help, develop an immunization protocol, when to deworm, what to deworm with, and even same with vaccines, what to vaccinate for, some nutritional advice as well. And I think it is very important to mention here that, preventing disease is cheaper than treating disease. The cost of our drugs are going up, with each year that passes by. So that means the bill for for producers, it also is going up as well. So veterinary costs I will admit, are expensive. And so our goal as veterinarians is to maximize the producers, returns, maybe where you don't have to see us as much on, emergencies or, whenever complications, maybe we can prevent some of those so you don't have to come see us as much. And then reproductive management, preg checks, semen evaluations, and trick tests, and then biosecurity. If you get into a train wreck at your operation and you need our guidance, we're here to help, and how we can prevent this from happening again in the future, and preventing certain diseases and whatnot to spread. So, the title of the presentation is Planning for Your Ranching Years. So a planning framework, I think, is beneficial before you sit down and decide what you want to do. And this could be whether you're a new producer, or you've been raising cattle for a few years now, or several years. I think it's important to kind of sit down and decide what your actual production goals are for that particular year and going forward. If you're just now getting into the cattle business and you don't know much about it, and you want to begin by just having some cows and turning the bull out, having some sort of breeding season and timing when you're going to calve, I think is very important. Is your goal, last year did you have a 90% calf crop? Are you trying to increase that? So these are some of the goals that I think we should have as producers, to have goals moving forward, so we can, one, maximize our returns and lower the amount of input that we have to put into an operation. And the purpose of this presentation, I kind of set it up to be a seasonal type approach. So most of this is planned around a true breeding season, which I'll talk a little bit further down in the presentation, the importance of a breeding season. But that you're having a breeding season, you're able to manage your bulls better. You'll be able to have a more organized approach to when you're going to test your fertility test, your bulls, trick test, when you're going to turn the bulls out. I think it's also important to plan ahead whenever it comes to the veterinarian that you're helping or you're using, and keep in mind that, we test a lot of bulls every year. And so if you need your bulls tested at a certain amount of time, in a certain time frame, it's important to, schedule ahead with your vet, because we do get busy, and it's, if you can schedule out a couple of weeks in advance for us to, test your bulls, and that's helpful. And planning around the breeding season can also help you with when you're going to vaccinate your heifers, your cows, your bulls, and then really what kind of vaccines you're going to use. Is it modified live? Is it killed, nasal? And then which animal within that subgroup, which one uses that particular vaccine. And then, nutrition and reproduction. When are you going to breed your heifers versus your cows? Are you going to stagger your heifers behind your cows just a little bit, or bull management, preg checks, or when are you going to do that? I know I just talked a little bit about bull management, but I think it fits in with reproduction as well. And then management risks. Are you buying calves from the sale barn? Do you have a stalker operation? So what is the disease prevalence, or what's the risk of buying those sort of animals? I think it's important to have that ahead of, know that kind of information ahead of time. So one, you can plan ahead and prevent some train wrecks from occurring. And so the seasonal approach, the first part is the pre-breeding or the breeding part of the season, and where I always think is the most important place to start is with the bull, because the bull is 9 times out of 10 going to be the most valuable animal on an operation. A cow used to cost $1,000, $1,200, and now certainly they're more than that, and a bull would always be $2,500, $3,000 depending on where you go. Of course, now they're more, but a bull is usually quite a bit more expensive, because these are the animals that are going to be introducing new genetics into your herd. You're not going to keep a bull for 10 years. You might keep a cow for 10 years. So the bull is your best chances of injecting new genetics into your herd. And so with that being said, I think fertility tested, I put on here that it's recommended and required. And for the sake of this presentation, I'm going to say that they're required, because one missed calf, a calf's worth $1,500, $2,000 now. If you miss one of those, one calf, then that's a significant loss. And when is the best time to test these bulls? Assuming you have a breeding season, 60 to 90 days before breeding is kind of the sweet spot. And that's for a couple of reasons. One, it takes, for whatever reason we fail the bull, it takes 60 days for a bull to produce a new sperm cell. So we retest at 60 days. And if he's no good at that point, well, then that gives you a little bit of time to find a new bull, source it elsewhere. Also, if you have to treat the animal for an infection, you also have time to, treat the animal and retest it and see how that, see if he's good at that point, which still gives you time to try to find a new bull going forward. Now, trick testing, I put here strongly recommended. I should have put a required for the sakes of this presentation, but that trick. So what is trick? Trick is a sexually transmitted disease from cattle, and it is a protozoal organism that persistently lives in the herd, especially most importantly the bulls. And what it causes is it will cause infertility and early term abortion. Now you won't have 100% embryo or infertility. I guess you could, but it's usually you're looking at 30 or 40% lack of calf crop. So you lost about 30 or 40% of your calf crop, and that's a trick test isn't very much, and it sure is nice to have some reassurance that your bull doesn't have trick if you test. And then as far as immunizations or vaccines go, each individual animal in your operation, there's different areas where we have biggest concerns, and the concern for a bull from a management aspect is reproduction. So, I'm of the opinion that no adult animal needs a modified live vaccine, because the risk of bovine respiratory disease isn't as high. Not saying it's impossible, but it isn't as high in these adult animals. So I recommend a killed BVD with the venereal diseases, Vibrio lepto, and then Clostridials. Don't ever forget about those. Those are also important. All right. So now talking from the cow management side, I think the big points on this is ensuring that your cows are at a adequate body condition score, with that range being at a 5 or 6. And if you don't know how to body condition cattle, there are some resources online that can teach you how to do that, or at least give you some idea. It is subjective, so stick with what if once you start doing it, be consistent, and know and do some research on that. But as this chart that I got from Oklahoma State University, a study that they did, this is showing that the lower the body condition score, the less chances that they have to rebreed. So the sweet spot is about a 5 or a 6 body condition score. And with that being said, once they get fatter than that, once they get 7, 8, or 9, we do have a decrease in reproductive efficiency once they get up to that point. And as far as the vaccines go, the primary, just like the bulls, the primary concern is reproduction at this point. There is a secondary concern is what I put on here in terms of passive transfer, immunity that calves get through the colostrum, through the milk. There is a degree of that we consider, but that's not our main concern. Our main concern is getting that cow pregnant so we can have a calf. And like I said about the bull, BRDs, is a concern, but it's minimal. Hopefully these cows have already been vaccinated as calves with modified lives, so they don't need the modified lives at this point. And so the vaccines are about the same as the bull, actually the exact same. So the viral, the BVDs, respiratory, reproductive organisms, along with the venereal Vibrio lepto, then Clostridial with tetanus. It's also important to know that if for whatever reason you need a modified live vaccine, there's enough data out there to say that within 30 days prior to breeding, don't give a modified live vaccine, because the risks are truly there. And then as far as the mineral program, I guess I should have mentioned this on the bull as well. I do believe that they need multi-minute free choice mineral as well. And so a little bit further in depth about the body condition scores. So this chart kind of illustrates the body's basic needs for nutrients. And as you look at the very top of the triangle here, the highest priority is the basal metabolism. This is essentially the minimum amount of nutrients that they need in order for them to sustain life. The heart beating, breathing. This is kind of the top. So the animal is always going to put themselves first, and then the fetus second. Reproduction, as you can see as you go down further on the chart, reproductive function is one of the further things on the bottom on the list that they don't necessarily need to survive. They're going to take care of themselves first. And so I think it's also important to mention where these nutrient deficient areas of risk are, and that would be at late gestation and early lactation, where we suddenly need all of this energy to put into either fetal development or into milk production. So we're trying to mobilize the body reserves in the form of fat or some glycogen in the liver, so we can feed our body and in turn feed the growing fetus in milk. And then it's also important to note that 60 to 90 days, the last 2 or 3 months of gestation, that we get this sudden, exponential rise of, the fetal size and development. So these are the areas where, we're going to need more nutrients. So this is where the nutrient deficits usually occur. And now, as we talk about when we're going to work our calves, and keep in mind this is all a seasonal approach, so it's convenience. When are you going to have all these animals up in a pen at the same time, or when are you going to gather them? You're not going to gather just the cows or just the calves, so you're going to have everyone here. So this would be a good time, pre-breeding, to work your calves and brand your calves, and that's why this is the most convenient time. And so at this time, I always I think Therapies is a really good product, and it really does help minimize some of the stress, especially when you get to weaning, and that's more what it's labeled for. But it does help. It does help with that. And then immunizations at this point, the Clostridioides with tetanus, the tetanus being the big part because if you're doing a traditional castration with the pocket knife or however you do it, the proximity of dirt, Clostridial tetanus, especially in the Clostridial vaccine, is important. And at this point, I don't think we need a modified live vaccine for BRD. Granted, the BRD is the biggest risk at this point, but they're also nursing on moms, so the risks aren't as there. But the bacterial BRD, Probac, Bimeda makes that. It makes a product called Probac, and it has some of the bacterial respiratory agents that aren't necessarily in most of the other manufacturer companies that, Zoetis. I don't know if they have these particular bacteria in those vaccines, but it has Mannheimia, Pasteurella, Mycoplasma. I think one of them has Salmonella in it, and I think that's pretty important. And then as far as deworming goes, depending on when your breeding season or your calving season is, with the new introduction, or hasn't reached the United States yet, but the screwworm, that's going to be important on how you time that, so you can prevent the screwworm myiasis from occurring. Now, this is the part of the presentation where I'm going to try to emphasize the importance of the breeding season. And typical breeding season windows are, 45, 60, 90 days. And that's how long the bull is with the cows. And the shorter amount of time in your breeding window, it does make your selection pressure a little bit heavier on reproduction. So 45 days is selecting very heavily on reproduction, and then of course 90 is not as there's not as much pressure on that. And the point of this is you're able to earlier evaluate the cows that don't breed, and the goal of a calf, if you're trying to get a specific calving window, the goal of that calving season is if we have a cow that breeds outside of, the 90-day window, for instance, well, then we can mark her, let her raise her calf, and then get rid of her here in the future. So the goal, tighten up that calving window, and, whether you use artificial insemination and follow up with a cleanup bull, you have some time to squeeze in there to do that. And so more about the breeding season, benefits truly of a breeding season is, what we're trying to do as producers is we're trying to make more money with putting less input, having to work less. And so what a breeding season gets you is a more uniform calf crop. That's exactly what if you take your calves to the sale barn, that's exactly what the buyers are looking for. They're looking for uniformity within your group, so there's no speculation on how those animals will grow. That they're probably going to grow consistently, so that just makes them more marketable. And there's some research out there that tells you that they bring more, dollars per pound on a per head basis whenever you do have a more uniform group of cow. And really the only way to efficiently create a uniform group of calves is by having a breeding season. So I think that's extremely important. And by doing so, you're going to improve your reproductive efficiency of your cows, because you're going to be able to identify the open animals earlier, and you're going to have your later breeding cows that calve outside of that calving window. Well, those animals, if you get rid of those, then you're going to tighten everything up, more uniformity and more marketable calves. So you're going to make more money. And with that being said, too, the breeding season will help you monitor your health and the nutrition of your animals a little bit easier, especially. It's especially easier to schedule when you're going to vaccinate, when you're going to castrate, when you're going to pull bulls, when you're going to do pretty much everything on this on an operation standpoint, and then concentration of labor and cost, cost reduction. If you spend less time looking for cows that are pregnant, if you have a year-long breeding season, you have no idea when majority of your cows are going to calve. So you're just checking them year round, and that gives you more chances to have complications. And driving out to most people don't live on their place. Some people have leased pastures. Driving out there, drive time, paying for fuel, wear and tear on your vehicle, that adds up. And our goal is to maximize our returns. And then also with the breeding season, you're able to apply some of these reproductive technologies that we have. If you're trying to do some artificial insemination, embryo transfers, and that. And so here's some of the calving data that I pulled off the USDA APHIS site. And this kind of tells us what percentage of the herds in the United States have, one defined breeding season, which 34% of the herds in the United States have this. And then no set breeding season. More than half of the cow-calf operations in the United States don't have a set season for calving. And that's a unfortunate statistic, but that's the reality of it. And there's some asterisks. Here are the seasons: spring, summer, fall, and then the asterisks next to them are typically where most people either calve or work calves, or that's when most of them calve. And most of these are decided on tradition, what's been done historically, and then the weather patterns. West Texas, you don't necessarily want to calve in the summer, because that's one, terrible for the animal, for the producer, everybody involved. And then up north, you might not want to calve in the wintertime just because it gets so cold, and that's a real thing some places. And then some other reasons why we choose to calve when we do is, when is forage availability going to be at its highest, and when are we going to market? I know this is a beef cattle. This is a cattle raisers meeting, but sheep and goats. Are you marketing your sheep and goats at a during an ethnic holiday, so they're trying to bring more? All of these are important things to consider. And then kind of on the next part of the seasonal approach is preg checks and weaning. At this point, you should have a calf on their side still. So you're gonna be weaning them. At the same time, you've already had your bulls pulled for a couple of months at this point, and you call the vet, or you do it yourself, and you're preg checking your cows. And the ideal spot is 60 to 90 days after pulling the bulls. I use the ultrasound myself, and I can detect them pretty accurately up to 30 days after I turn the bull out. But a safer bet, 60 to 90 days. That's a reasonable time to do that as well. And what this benefits you from a cattle producer is and I've emphasized this a couple of times, is you're going to determine the open cows sooner in the production cycle, so you're able to cull them. Not only make money by selling them, ideally you wanted them to have a calf previously, but you're also gonna have less competition for the rangeland forage, so other cows may be able to recoup a little bit better, and maybe hold up a little bit better, and give your pasture some rest. So really, indirectly, you'll make more money getting rid of these open cows. And I'm sorry, I don't think there's any productions, any operation that benefits from an open cow. That's my opinion on it as well. Now, in preg check weaning, calves, generally, like I said, the convenience of when you're going to wean is whenever you're going to do preg check, for simplicity's sake. So you're going to gather all your animals at the same time. So you might as well get something done while you're doing that. And so at this point, calves in the United States generally wean 6 to 7 months of age. There are some variations there, but that's probably average. And keep in mind, calves are your primary source of income. If you're just calling open cows and that's your income, well, then I think you might need to take another look at your operation. And then weaning strategies, there's multiple methods. Conventional, essentially separating the cow and the calf and putting them in different locations. Fence line weaning, kind of like the picture, depicts. And weaning rings, those aren't. I'm not a big fan of those. I don't know the success rate on those, but essentially it's a ring you put on their nose, and it essentially they have spikes on it, and as you put them on the calves, they poke mom in the udder, and the mom doesn't want them to nurse because of that. And then gradual, from left to right, they get decreasing in popularity. Probably conventional or fence line are the most popular. And then where therapies falls in, and this is where the labeled therapies comes from. This is what it was designed to do, is to minimize weaning stress. And it does it. I don't. Those calves definitely don't bawl as much if you do that. And I think the label says to do it the day before, but practicality, I don't know that most people do it that way. I think doing it the day of is better than nothing. And as far as vaccines go, the primary concern at this particular point in the production cycle, respiratory disease. We're going to stress these animals out. Their immune system's going to be lowered because of that. So respiratory diseases, BRD especially, are the ones that we are concerned about at this point. We've already given the Clostridial with tetanus, hopefully at working, and this is just a booster on that particular product. You'll also be boostering the bacterial components of the BRD, the Mannheimias, the Pastorellas, the Mycoplasmas. And then at this point, I think this is a reasonable time to introduce the modified lives into your protocol. And there's multiple different brands out there. I'm not going to speak for any of them in particular, but this is the appropriate time. You may ask on the working why you didn't give a modified live at that point. Well, they're still nursing on mom, and there is a risk that has been proven that they can, not very likely, but they can be viremic, which means spreading that virus, and they can theoretically give it to a cow, especially if that cow has never been introduced to that vaccine. So, modified lives have their place, and I think it's important to understand their use and how to go about using those particular products. All right. So kind of to wrap everything up, I like to make a take-home points for just to kind of do a brief overview of what we've done. And, planning generally, saves money, whether that that decreases your input or makes you more money because you're decreasing the amount of labor you have to put into your operation. Veterinary oversight is essential for herd health and development planning. Prevention, that's that key point. Prevention of disease is cheaper than treating disease. Bulls bulls recommended or require yearly fertility test, trick test, and annual vaccines. Cows need body condition score of 5 or 6 at pre-breeding, and ideally as at weaning as well, to maximize their reproductive efficiency and production overall. They're gonna produce more milk whenever they have more energy reserves. And then at the same time, vaccines are going to respond better to vaccines whenever they are healthier, and preg check those animals at weaning. And then the weanlings, therapies, vaccines, and then of course process them appropriately. So that's all I got. And so if anybody has any questions, I'm more than happy to answer anything.
Thanks. Let me pull up our questions and see what we got coming in.
Okay.
Okay, first question. When I buy cows at the sale barn, I keep them a few fields away from the main group. But how long do I need to do that to keep them away? What's a good time frame?
Um, I would say a minimum of 30 days. That's generally the time I tell producers, and assuming you don't know their vaccination history at that point. Hopefully, you know if they're pregnant or if they're open at that particular stage. So if they are, I think making sure that they're immunized, dewormed appropriately. I think about 30 days is about the. I think is a good point, good part.
Next question we have, and I'm probably not going to pronounce this correctly, so permetrin, 1%,
Hmm.
works with regular cow flies. Thoughts on
Hmm.
how it would work against screwworm?
Oh, and there's no doubt it works against a screwworm. It's a repellent based insecticide. I think I think making sure you have your cattle, especially when the screwworm gets here, I think it's very important that you keep the flies off the cattle for that aspect. Uh, there's a whole nother talk that can be talked about screwworms in general and how to prevent them. But permethrin's a good product.
Next question, would you need to trick test every year if your bulls never left your property and there are no new calves introduced?
Oh, I personally I do I think that they should just because yeah, you said they had the bulls hadn't been there, or you hadn't got any new cows. You have no idea if the neighbor's bull didn't jump over and breed your cows. You have no idea. And then I really think that they need to be trick tested on a yearly basis because of that, just because of the unknown. That's when trick pops up, is whenever you had no idea that something happened. Um, you know that's I think yearly is that's my answer.
Mhm. Okay, we'll give everyone a few more seconds to get their questions submitted. Do you have any final thoughts, or with January, February months, anything that the viewers can keep in mind? Any last comments?
Well, I know it's supposed to get cold this weekend, so
Yes, it is.
make sure you make sure they have plenty of food. I don't know if it's going to snow or not, but depending on where you are in the state, make sure nutrition. The cows like to calve whenever it gets cold like this, so I
Yes, they
guess go
do.
check your cows and make sure everything's okay.
Yep. Okay. And we did have a few more trickle in.
Okay, yeah.
So, Probac vaccine at initial working of calves and at weaning. If so,
Hmm.
do we need MLB?
Yes, so that has the different pathogens in it. Those are bacterial pathogens, whereas the modified lives are viral in nature. The Probac, I think there's other companies that make that, but it has the bacterial components of BRD, which most of the vaccines, don't have those particular pathogens in them. So, yes, work give it to them at working, give it to them at weaning as well, in conjunction with the modified live vaccines.
Should I alternate the pour on fly treatment that I use each year to avoid developing resistance?
Uh, Rotating dewormers. We've seen this tragedy go with the sheep and goat industry, and I do not believe in rotating dewormers. You know, once you start rotating dewormers, there's only four classes of uh, deworming, three or four broad classes of deworming agents that we have for all species essentially. And once one, I guess, so a better recommendation for that would be, if they are wormy, check a fecal, make sure that they are wormy before deworming. Majority of cattle, at least in West Texas, majority of those cattle aren't going to be wormy. We more do it for grubs, fly control, but from a internal parasite standpoint, rotating dewormers is never a good idea in my mind. Once you start rotating the dewormers, you're starting to select for resistant parasites by doing so. So, what I tell at least the sheep and goat producers, check fecal egg counts and and stick with one dewormer until that one's not effective anymore. There's all these combination products out there that have two, maybe three different types of dewormers in there. And once you start mixing those together, they become less they don't work as good. And so my general recommendation, stick with one dewormer till it doesn't work, and then go on to another. And there are other, if we're only using it for fly control, then there's other products for that. Dewormer doesn't necessarily need that.
Should MLV be used on calves at weaning mainly?
Yes, they should. If they're on calf, or if they're on the cow, if they're lactating or nursing from mom, I don't believe that they need a modified live vaccine. Once you wean them, that's when the stress begins. That's whenever they're more likely to get the disease. There's probably different schools of thought on that, and in fact, I know that there is, and that's my opinion on it.
Do vets charge when visiting a property for the first time to establish the VCPR?
Yes, we do. Mostly for mileage. We got to leave the clinic, go mileage. Probably like a brief exam type of a charge. But there's also a way of establishing care by bringing the animals to us. That saves you, at least in most cases, the mileage part of that. So we're flexible. We can help if you schedule it in advance.
When calving heifers, how long should you wait after she starts birthing before assisting?
I would, usually within the hour. If there's no progression of pregnancy, then you need to start assisting. There's different stages of the pregnancy, but I generally tell producers 1 hour, and if they haven't produced anything, then they need to start assisting.
Okay. So this is kind of a longer one.
Okay.
We'd like to stock up on antibiotics for ad hoc situations where they may be necessary. What's the easiest way to do this so we aren't stressing at the 11th hour? Our vet isn't open on weekends, and they aren't exactly jumping to give us medical supplies ahead of time.
Right. Oh, so stocking up, I don't like the stocking up on antibiotics word, because that tells me they have the potential of staying on the shelf for too long. And then I've had producers give LA 200, for instance, that's 10 years old, and it's probably not going to be good at that point. In terms of stocking up, like I said, I don't like that particular phrase. I think it's a reasonable idea to try to plan with your veterinarian and kind of express your concerns of why you might need it. Or are you going through a respiratory disease? Go check your cattle, look for sickness. Are you having respiratory disease? Are you depending on the situation, I'm more inclined to send some based on the one particular, one disease. Like if they have respiratory disease, I'm more likely to send one antibiotic and plus that gives us some client communication wise too. The client may not necessarily know what antibiotic to treat that particular disease with. So it's always good to have your veterinarian informed of what you're doing, and we're more likely to send antibiotics home on a per situation basis as opposed to stocking up.
Right.
Hope that answered it. I know I've kind of mumbled around it.
You're good. Okay. Final call for any questions. Give everyone another 10 or 15 seconds or so. Okay, well, we are out of time right at 2:01 on the dot. So we just want to thank everyone for joining us today for our Ranching 101 webinar. Thank you for joining us, Dr. Davidson. Sure. Greatly appreciated, and we hope everyone has a great afternoon. And we look forward to seeing you all for the next Ranching 101 webinar on February 17th, Herd Health Basics before spring. Let us know if you have any questions. Thanks, everyone.
Thank you.
Mm-hmm.